Okay. Good. Let me first of all say good evening to your cherished listeners, and then good evening to your team. If, as you recall, just a few days ago, I think last week, we rolled out a roadmap to press home the implementations of our conditions of service. How did it start? We negotiated the conditions of service in 2024. We actually concluded in May, but we agreed that there was not going to be any backdating, so we should put the implementation date to July 2024. Just as they were about to implement the conditions of service for us, a section of us took us to court and placed an injunction on the implementations of the conditions of service, with the reason that they were not consulted while we're doing the negotiation. Whether they were right or wrong, we felt they could have drew our attention that, look, this exercise you are engaging in, we are entitled to be part, because we have called the other nursing unions in the Ghana, the Ministry of Health, to partake in the process. So it was just an oversight. We were not able to add them. So they could have come forward to say that, look, we need to be part. But they chose to wait. They chose to wait until we finish the negotiation, and during the implementation, they put an injunction on it. During this period, other unions also started their implementation, their negotiations, and finally signed theirs and got implemented. That of nurses and midwives could not have been implemented because of the injunction placed on it, because nobody will want to be cited for contempt. So at that time, government was restrained. And it isn't that the government was not ready to implement it, because they had done that for the certified registered anesthetists, they have done that for physicians assistants, they have done that for Ghana Medical Association, they had done that for Health Services Workers Union. The only challenge at the time was the court injunction. Moving forward, during the transition, we anticipated that a new government was coming in. So in January, we started engagement with the then chief directors. When the political heads are taken off, it is the chief directors who holds the ministries for government. We tabled all our concerns, and it was sent to the chief of staff. At that time, the chief of staff was implemented. And the people we are leading, they were just like, others are enjoying their own. Let's do something and get it. Then we said, no, the government they are in transition. There is no minister. So who is going to approve whatever that we have signed for? So they should exercise patience. Let's get our minister first. We got our minister appointed, vetted, and confirmed. So we said, okay. During the engagement, they said, you see, if they don't read the budget, it will be difficult. So let us read the budget. So we said, okay, we went and assured our members that, look, because of the budget, we have to hold on for now. Any intended action we want to have, forcing us to pursue. Because I wanted to be fair to the new government. They said, okay, budget was read. We had series of meetings with the Ghana Health Service and then the Ministry of Health. What we keep on hearing was, just be assured that it will be implemented. At a point, the minister was getting angry with us because he feels he has opened his doors and then he is always available. Why do we have to, adopt a certain posture? But the fact is that those meetings never pinpointed how our conditions of service will be implemented. Pressure was mounting on us, and we said, look, exercise restraint so that we will work around, because strike is the last resort to use when it comes to labor relationship. Nobody enjoy declaring strike. So let's do the dialogue and see what will come out of it. In one of the engagement, when we push the minister, you tell us what is this? What is the timelines? When do we expect something to happen? He said he can't commit himself because what he's assuring us is the conditions of service will be implemented. So we should just exercise patience. Sheikh Umaru, can we go back to tell our members that this is what the minister is saying and they will accept it? So, because we're not seeing any way clear, we said, okay, let's roll out some series of actions to draw everybody's attention to the fact that we are not being fairly treated. Because people who even negotiated their own later than ours is enjoying their conditions of service. We can't blame anybody for the court issue. We can only blame our own colleagues who took us to court. So we said, let's roll out an action. And we carve the action in such a way that we should be able to allow the employer to use that period to address the issue before it escalates into something else. Nothing of that sort happened. And Sheikh Himuro, let me tell you, sometimes employers feel because there is a clause banning us from taking certain industrial actions, they can always hide under that cover and check their own responsibilities. Because after all, everybody will say that essential services are not allowed to go on strike. But that same law also prescribes how essential service providers should be treated. Let me put on record that we nurses and midwives who are taking care of the health of the entire nation alongside with other health professionals. When we are sick, we remove money from our pockets to treat ourselves if it is not covered under health insurance. And even whatever that is covered under health insurance, if a particular drug or a particular service is not within your hospital, you have to remove your money and go and pay. And we are receiving other essential service providers. They come, they themselves are entitled to their spouse, 4 children. And even when they buy drugs from their pocket, they go and reclaim. We are not seeing like that, but the public doesn't know. So we move on, hoping that something will come out. They call us for this meeting, 9th June, today, at the instance of the Fair Wages and Salaries Commission. So we're very excited that probably today we will have something to go and tell our members, and they will relax their position so that we can all sleep, because we can't sleep. Only for us to meet, and we are told that budgetary constraints, they didn't capture our conditions of service in the budget. Sheikh Umaru, is this fair?
Citizen TV, Accra, Ghana. Citizen TV, the citizen's power.